Good afternoon.
Good afternoon.
Hi, Patrick.
Hey, okay. How's everybody doing today?
Good, Patrick. How are you?
I'm all right. This is my second of three bidders conferences today. I did four yesterday. I'm so tired of hearing my own voice. So I'm actually just going to let y'all talk amongst yourselves about resource coordination activities for the next hour. No, I'm not. Uh, but also, I just got a phone call from my kid's school nurse saying that she's got a sore throat. So I'm trying to coordinate her grandparents picking her up and taking her home at the same time. Also,
Well,
getting more information about Mpox cases. And yay, it's all happening.
It's
It's
that
all
time
happening.
of year. I know. I know. Do they send home for sore throats or does she want to come home?
She wants to come home. She's 9. She was very excited about going to school this morning, but then she was like, Daddy,
Mine wasn't.
why do
And
I
she's
sound
9
like
too.
this? Yeah.
No, she's like, I gotta something. I was like, did you drink water? Here's a lozenge. I was the opposite.
No, I totally tried that. I was like, "Do you want to take a cough drop?" And it's like,
I was
"How
like,
about
here's a
an?"
Ludens. I'll put some in your backpack.
My kid was like, "I'll take Altoids." Like Altoids don't do the same thing, baby girl. They don't. But okay, here, have an Altoid. It's fine. All right. So, thank you all for being here for the Chicago Department of Public Health Bidders Conference for Syndemic Infectious Disease Resource Coordination Hub RFP, request for proposals. My name is Patrick Stonehouse. I use he, him, his. This is also for the recording, not just for those of you who are physically present or participating who know me, but for those who don't. Patrick Stonehouse, he and his, anything with respect is fine, with the Community Health Services Division of the Syndemic Infectious Diseases Bureau of the Chicago Department of Public Health. And yeah, we're going to talk about the Syndemic Infectious Disease Resource Coordination Hub. So I'm going to go ahead and share my screen and get going on this. Can you see my screen?
yes.
Yes.
Lovely, thank you. All right. So, first thing we're going to do is just go over the outline of this presentation. We'll do a brief overview of the Syndemic Infectious Disease Bureau portfolio. This is portfolio of contracts, so services that we support through delegate agencies. We'll talk about the Syndemic Infectious Disease Resource Coordination Hub just a bit, and then talk about how this and other RFPs that we put forth align with the values and goals of Healthy Chicago 2025, CDPH guiding principles, and our values around health and racial equity. So the portfolio of services is meant to be an interconnected system of services as opposed to a bunch of standalone services going on at different organizations that don't really communicate with one another and aren't coordinated in a complementary fashion. So it really is meant to be all of the different organizations and activities that we fund and support coordinated with one another to be able to be complementary, to fill each other's gaps, and to sort of amplify the effectiveness of all of the different services that we support and those that we do ourselves, because CDPH does have direct services that we provide as well that should be involved in this system. So we integrate funding across 8 different funding sources. Center for Disease Control and Prevention, High Impact HIV Surveillance and Prevention, CDC STD, CDC Viral Hepatitis, Ryan White, HRSA Ending the HIV Epidemic, Housing Opportunities for Persons with HIV, City of Chicago Corporate, and some Illinois Department of Public Health funds. Wherever possible, We want services to be integrated into a status neutral delivery system, meaning that an individual who has HIV has the same access or has access to the same services as a person who is vulnerable to HIV. This is all, of course, based on the availability of funds, as we have funding from both Ryan White Part A and HRSA Ending the HIV Epidemic that are specifically for services for people with HIV. And we don't have as much funding for individuals vulnerable to HIV. Still, we want to try and leverage other resources that exist either within our system or at different organizations to be able to provide as much access as possible. And wherever possible, we want to use a syndemic approach, meaning that while a particular RFP may be focused on HIV, that we want to work with those, we want to work together to make sure that the other elements of syndemic infectious disease are being addressed for those individuals. So sexually transmitted infections, viral hepatitis, tuberculosis, Mpox, or any other area of public health concern that comes up. A good example, I think, of this is the HIV STI Resource Hub, which is the version of the Resource Coordination Hub that's coming to an end shortly, and that for this RFP is establishing new contracts. It is the incorporation of information about Mpox into the services and information being delivered. So when we started that contract with the AIDS Foundation of Chicago to do the HIV STI Resource Hub, we were not thinking about Mpox in the jurisdiction. And then early summer of 2022, Mpox comes into the jurisdiction. So we need to incorporate this information into the work that we do. And of course, as with all of our activities, we need it to align with local, state, and national plans for ending the epidemics of syndemic infectious disease, including getting to zero Illinois, the National HIV/AIDS Strategy, and others. The portfolio of services roughly breaks down into four buckets. One of which being health equity. And so those are our efforts that are looking specifically at the experiences and outcomes of individuals who are members of populations that are disproportionately impacted by HIV. This can be in the manner in which we do analysis of the data, so looking at what proportion of services are delivered to individuals who are members of prioritized populations. It can be looking at outcomes. It can be developing strategies for recruitment and engagement and retention. It can be looking at systemic and structural barriers that different populations experience and then coming up with interventions to try and get rid of or get around those barriers. Housing is exactly what it is. So this is housing opportunities for persons with HIV and housing opportunities for persons vulnerable to HIV. Healthcare, which is the clinical service delivery, and how to, which is about like making sure folks have information, have access to resources that are available to them and are supported in learning the different ways through which they can have easier time accessing and benefiting from all of the different services and supports that exist in the jurisdiction. And this is, I really want to update this, but I also still really like it. This is just the model that we based all of our services around. So the concept behind it, right, is that all individuals who access services in the portfolio start with being recruited and screened. And then they go through a series of steps depending on their HIV status and whether if they are a person with HIV, were they previously diagnosed or is this a new diagnosis? But regardless, there's a connection to uh, different steps in order to get an individual linked to care and support services that allow individuals to have an easier time progressing through those steps. And once connected to care, the support services stay on, as well as the direct engagement on the clinical side, to have that person be meaningfully engaged in their own care, have autonomy over the mechanisms of their care, be engaged, be retained, adhere to the medications and treatment to achieve the desired health outcomes, which are durable viral suppression for people with HIV, and durable PrEP adherence for individuals on PrEP for HIV. And surrounding all of that are these other components that go to addressing more like almost environmental side of things. So marketing and communication efforts, resource coordination, community development, which means systemic and structural interventions, services for people who inject drugs, which used to be a part of the Syndemic Infectious Disease Bureau. It has since been transferred over to the Behavioral Health Bureau of the Chicago Department of Public Health, so it can be better integrated into the collection of harm reduction activities that they fund with a lot of the same organizations, but it's all like wraps up together in a single space. For all the collection of services and supports for people who are active in their substance use. And then, of course, housing information, and direct housing through housing opportunities for persons with HIV, and housing opportunities for persons vulnerable to HIV. So the hub. So the City of Chicago, through the Chicago Department of Public Health, is seeking qualified organizations to provide resource coordination services for people with HIV, people vulnerable to HIV, and individuals impacted by syndemic infectious disease through the use of multiple funding sources, service categories, and modalities to support individuals, to identify needs and resources, to address those needs, facilitate connections with resources, including scheduling appointments, and following up with individuals to assess their satisfaction with the services they received. Currently, as I mentioned, we do currently have a contract with the AIDS Foundation of Chicago to implement what was known as the HIV/STI Resource Hub, or sometimes just the Hub. That contract ends February 28th, 2026, and so this RFP is to establish a new contract beginning March 1st, 2026. So again, the Coordination Hub offers services via telephone, web-based, and in-person service delivery. Coordination includes the provision of information, referrals, and active appointments to services delivered through all syndemic infectious disease clinical and supportive service providers in the city of Chicago, the Chicago eligible metropolitan area, which is the jurisdiction for Ryan White Part A and HRSA ending the HIV epidemic, and the Chicago eligible metropolitan statistical area, which is the jurisdiction for housing opportunities for persons with HIV. And for those of you who don't know, it's the collection of counties in this general vicinity. So it's Cook County, DuPage, Kane, DeKalb, Henry, McHenry, Lake, Kendall, Grundy, and Will. But we'll actually, I think we go over that a little bit later in greater detail. So approximately $2,760,000 will be made available through this RFP per year. This is depending upon quality of applications. It's also depending on the resource allocation, which is a required component of our Community HIV Planning Council, wherein they say this is how much money goes to each of these service categories, and we are required by law to adhere to those allocations. So that could push the amount available for the service categories involved in the hub up or down, depending on what they do. Um, the new contract will start March 1st, 2026, run through the end of February 2028. There will be up to 2 extensions, each not to exceed 1 year. These extensions will be issued at the discretion of the city based on availability of funds, a demonstrated need, and performance of the delegate agency. And this particular RFP is funded through Ryan White Part A, CDC High Impact HIV Prevention and Care Funds, Housing Opportunities for People with HIV, the Housing Information Services specifically, and City of Chicago corporate funds. And there may be opportunities for having other funding sources worked in, but it would be of that body that I mentioned earlier. So Illinois Department of Public Health could, HRSA ending the HIV epidemic could, and we do have funding sources related to viral hepatitis and tuberculosis, which could also be incorporated should the need arise. Common among all our RFPs. So this next section is just going to be some information about the general content of all RFPs that are not specific to the Resource Coordination Hub. So all RFPs have scoring categories by which we evaluate the proposals that we receive. We are required to have panels of individual reviewers or of reviewers who are going to take a look at every single application or proposal that gets submitted. These panels are not to be less than 3 people, are required to be an odd number of people, and at least one member of each panel is to be someone who does not work for the Chicago Department of Public Health. So the way it works is each individual is given 5 or 6 proposals to review, depending on how many total we get. And they are giving their training on what to look for, and then they score and give comments for every single proposal, every single prompt response that they review. We then bring together the scores of each member of a panel, and we average them out. And if there's a significant like outliers involved, so like two organizations given a proposal like a 30 out of 100, and the other one gives it a 95, we will bring folks together to sort of discuss why there's such a significant difference between the scoring, and try to come to a consensus of what does this panel of three say is like this is the end average scoring. If that end average scoring is less than 80 points out of 100, that is the end of the journey for that particular proposal. By CDPH policy, we don't award anything to a proposal that comes in at less than 80 out of 100 points. And just in case, like there have been times in the past where we're like, all right, well, nobody got over 100 points or over 80 points. Well, then we put the RFP back out and we do the whole thing over again. Let's hope that doesn't happen. So everything we do aligns with Healthy Chicago 2025, and Healthy Chicago 2025 is the city's plan to address the life expectancy gap experienced by Black Chicagoans as compared to non-Black Chicagoans. So this RFP aligns with that in that it is, generally speaking, HIV, viral hepatitis are among infectious diseases that contribute to the life expectancy gap. But the idea behind the hub is to dramatically lower the threshold by which individuals are able to access the services that exist in the jurisdiction toward gaining a greater level of health and well-being. So low threshold, high impact, strong connections to the services that exist, and follow-up to make sure they were done well. Um, we evaluate proposals partially based on what the applicant says they're going to be able to do in terms of reach, and the services they're going to be able to provide to the different populations that are most impacted by HIV in the jurisdiction. And we want folks to know that upon award and implementation, part of what we're going to be doing is evaluating their performance based on the experiences of members of those priority populations. So if we'll do like a really simple example, if you do, did you like how you were treated in your engagements with this agency? Yes or no? If, 75% of all people said yes, like, all right, that sounds good. But if 80% of Black individuals said no, all right, well, that's a no then. And that's the kind of evaluation we need to be providing and conducting in the services that we're supporting. So guiding principles in regards to Healthy Chicago 2025, which used to be our Dismantling Racist Systems prompt, organizations are requested to describe general alignment, how leadership and decision making is conducted in such a way as to go against existing racist systems, and how organizations hold themselves accountable to populations that are most impacted by HIV and other syndemic infectious diseases. Uh, Preventing trauma and providing trauma-informed services, so focusing on the experiences of clients and staff, building trust and transparency within the organizational decision-making, and looking at programmatic and surveillance data to identify discrepancies and disparities as experienced by our populations most impacted. And based on that assessment or that identification of disparities, how organizations are going to adjust services, how we're going to adjust organizational policies and practice in order to address those disparities. And we do want organizations to talk about the extent to which members of priority populations or populations most impacted by HIV have been involved in developing the proposed program, and the involvement of any community advisory boards in how the organization constructed the proposal and will carry out the proposal. And we, of course, are responsible for we're the recipient of all these funds from the federal government and state and local. And so part of our responsibility is ensuring that services are available to the entirety of the multiple jurisdictions that we're trying to take care of, right? So we need to look at specifically within syndemic infectious disease resource coordination activities across both the eligible metropolitan area and the eligible metropolitan statistical area. So yes, Chicago, certainly, but also what's happening in Will County. How many phone calls are we getting in Kane? And I am actually looking at a map right now. So there's 478 individuals with HIV living in Kane County. How many of them are calling in and talking about what? What is it that they're talking about when they call up? So all of that is stuff that we need in the proposal. And as we get proposals, more than likely there's just going to be the one award for the HIV/STI Resource Coordination Hub, but we may try to facilitate partnerships if appropriate, so that we have coverage over the entire jurisdiction. Um, and that's the presentation. If you have questions, you can send them to me. You can send them to John Pfeiffer, who is our Assistant Commissioner for Contracts and Administration. You can send them to hivfunding@cityofchicago.org. You can send them through, there's a portal in iSupplier there where you can submit questions about specific RFPs. And it's important for folks to know, like, this recording of this bidders conference will be posted publicly. Any and all questions that we receive will get a written response that will go into a question and answer document that will also be available publicly in the next couple of days. And that's actually that's the presentation. And the remainder of this session is actually for your questions so we can discuss. So we are recording. I'm going to be typing things down as well. But if you would not mind, just so make sure that the final product, the question and answer document that we publish is as accurate as possible. If you could, please feel free to verbalize any questions. Just raise your hand or come off mute. But if you would not mind typing in at least some semblance of the question in the chat so I can just like copy that, put it in the document and move forward with it, it would be greatly appreciated. And with that, I'm gonna get a drink of water and shut up and listen to your questions.
Awesome. Thanks, Patrick. So Allie Bowers, she, her pronouns. I have a handful of questions. I've got the RFP in front of me because I finally got access to a printer. I like paper and I'm old fashioned that way. So you were just mentioning that you said there's likely going to be one award for the hub. So I'm curious if that means, is there a possibility to separate these? Because I'm used to obviously the hub and then the like EFA Ryan White that has the transportation and housing and food. And so is this a combination of that? And can these be separated? How does that work?
The intent is for it to be like it's all in one space, right?
Okay.
If based on the content of the applications that we receive, we make a determination like, all right, this isn't going to work, then we have to do what we need to do in order to make sure the services become available through another mechanism. So ways I've thought about it have been, similar to how the initial hub was established. Like you had good stuff over here, you had good stuff over here. Hey, what if you two just work together on this stuff, right? Could be fine. It could also be like, what if we receive three different applications? Each one wants to do a different part of the eligible metropolitan statistical area. And like, all right, provided you're coordinated, I don't necessarily have a problem with that. But the idea is that all of the service categories are put together. Again, if the applications come through and through negotiation with successful candidates, we're like, this isn't going to work, then we will have to figure out another mechanism through which we get all of the services out and available to people.
Okay, that makes sense. Can you talk about, so I'm looking on page 8 of their RFP. There were a couple of mentions where some of the funds for this comes from City of Chicago corporate funds, but I'm not seeing an amount for that. So there's a large amount for Ryan White Part A with a whole bunch of services. There's the 500,000 for PrEP, and then there's the $1 million for HOPWA. But where does corporate come in?
So corporate is made available in the similar kind of way as CDC funding. So the nature of City of Chicago corporate funds is that it is not to replace, but to fill gaps that for which other funding sources don't exist. So the way we're thinking about it, and the CDC funding that we receive is pretty tight. The City of Chicago corporate funding we receive is incredibly tight, but in the event that we find ourselves in a situation where we don't have sufficient CDC funds to cover everything that we need done, we have the ability to allocate some amount of City of Chicago corporate funds to provide similar services.
Okay.
And
So
so
is
you're not
there
going to
just-
see, there's not an
either.
amount. It's just like, there's like this much money. It's going to be a mix of these things.
Okay, got it. I know in the past, the corporate money has been a little bit more flexible, where there were certain things that like were specifically allocated to corporate for that reason. So just trying to get a sense of what that means. Okay.
Yeah, in the end, when we do the awarding and the negotiation of how to implement, we'll be able to have deeper discussions because it'll be final at that point, right? We'll know how much of what is being awarded, and we can go into for your corporate budget, for example, these are the things that you need to put on it.
Got it. Okay. Let's see. Okay, page 13 of the RFP talks about CDPH monitoring and support staff having direct access to client level data collected. So I know that that's something that's been talked about in the past. So I'm curious, is that, would that entail like, hey, you have your own login and then you see everything immediately, or you get like a separate thing that, you know, the agency would send weekly, monthly? I'm just trying to get a sense for like a conversation with IT, like, you know, and data services, like what would that look like as a partnership for having direct access to client level data, possibly all the time?
Yeah, the ideal situation would be like whomever your program officer from CDPH would be, would have the ability to directly go in and take a look at client level data related to the resource coordination hub. And yeah, we have talked about this before.
Yeah.
But just so for folks who might not have been involved in those conversations, uh, so I think about it similar to when during COVID, we established the COVID response corps as part of like the community response to COVID. And one of the things that it did was it stood up a call center to be able to field questions, schedule appointments, make referrals, all that stuff for anybody. And it was incredibly important for us as CDPH to be able to look at the client level data of calls coming in anytime so that we could see like, okay, something's happening over here because we got a bunch of calls from the same zip code, like in a matter of a couple of days, or we've got 16 calls that were all about the same issue. All right, something's happening there. And that level of, I mean, two things. It is really difficult to be able to predict what you're going to need in like a monthly or quarterly report in that way because it's about whatever's emergent, right? And the second part of it is monthly or quarterly is too late to be able to respond. And so, to the greatest extent possible, I want us to be able to have like we can go in whenever we need, get access to, and it could be like negotiated what content, what level of information, but to be able to go in and see something. Yeah,
Thanks. I'll yield the floor for someone else for the time being. Thanks, Patrick.
thank you.
Yeah, thanks, Allie. I just have two questions so far. So, I've been around HOPWA HISSS. My name is Jennifer Jimenez. She, her pronouns, AIDS Foundation Chicago, for the recording. For God, 18 years or something like that. So definitely prior to the Resource Coordination Hub, which launched 2019, 2020, and planning for a lot longer than that. So my question is, HOPWA HIS, as far as I know, have always served a EMSA, which excludes like King Kindle. And I heard during this presentation emphasis on EMSA, EMA, all the above. That also includes those areas. And I know right now the Resource Coordination Hub also serves some of those others in like through the Ryan White funds and all the other ones. So are we saying that for the HOPWA HISSS, now that it's part of the Resource Coordination Hub, we can also serve those counties? Is there going to be a change in that, a difference, if that question makes sense? So that's my
It
first
does.
question, but I'll pause for an
Yeah,
answer.
thank you. Thank you, Jen. So yeah, basically it's like because Housing Information Services is a HOPWA service category, it's the eligible metropolitan statistical area. There are 3 counties in the eligible metropolitan area for Ryan White that are not part of the eligible metropolitan statistical area. So if we get a call from someone in Kane and they're looking for Housing Information Services, what do we do?
We
And I think,
sometimes do.
yeah, which I'm sure. And the what I would want to do with something like that is, and this could be a part of the implementation as well, right? Is in the event that something like that calls or some that a call like that comes through, what other resources are available that can support that particular engagement with that particular individual, right? So as with almost everything that we do and we fund, here's a bunch of money with these restrictions and these requirements and these service categories, and let's not fool ourselves into saying this covers every single eventuality. What are those other things? What other resources can be made available to support in those instances? And we will do our best to figure out the best ways of doing it.
Okay. Gotcha. I think I see Allie nodding your head, so you got that right. And then my second question is, I heard an emphasis, and I appreciate this because we've been talking about this in all these different conversations prior, with other organizations, the vulnerable to HIV population. As we know, housing navigation, because we've been starting to see an uptick in calls, by the way. So the HOPWA can only serve people living with HIV, right? HOPWA HISSS funds. So thoughts on the vulnerable to HIV population that we want to hit under this RCH and housing nav services? So kind of similar question to the last one.
It is, because the funding that we have that can go towards services for individuals vulnerable are limited to CDC and City of Chicago funds and IDPH, although it's like $115,000, so that doesn't go very far. And the City of Chicago funds and CDC funds are restricted to the City of Chicago as a geographical boundary. So I think this is a similar space where like, all right, let's call on what other resources exist that can support people outside of the HOPWA system. So what other housing systems exist that we can tap and that we can connect folks, um, yeah, like basically what other housing opportunities exist. And that doesn't have to be like, we're going to go navigate to a specific agency. It's like, is there another entity that can help with the navigation into a housing system that is not specifically for people with HIV? Then we can connect you with that institution and they will take you from there.
Okay. Thanks, Patrick.
Yeah.
Hi, Patrick. This is Jamie
Yeah.
Frazier from Lighthouse Foundation of Chicagoland.
Hello, Mr. Frazier.
Hello. I've got two questions for you, and thanks so much for sharing this RFP with me.
Yeah.
First, suppose a smaller CBO is interested in providing non-medical case management and emergency financial assistance. Should it apply to this opportunity while partnering with another larger agency that offers more services, or attempt to become a subcontractor of the lead agency that becomes the hub grantee?
I actually don't feel as though I can properly advise in that direction. But all right, so basically, if you're interested in doing uh, one or more of the service categories involved in the hub, but not necessarily in taking on the entirety of the hub for the jurisdiction, what do you do? Is that your question?
It is, yes. I mean, so Lighthouse Foundation doesn't have the capacity in any
Right,
world
right,
to do the hub, but we wanted to provide a service. And so we
right.
wanted to know, how do we do that through this opportunity?
Um, yeah, I think the two options would be put together a coalition of organizations that would be implementing all of the services, and Lighthouse would do some of them, and another organization would do others, or uh, start having conversations with organizations whom you feel do have the capacity to do the whole thing, and basically pitch out your capacity to take on a component of it. You can always wait until an award is issued and then engage, or you could do it in advance and say like, hey, how about we become a subcontracted partner in your application?
Thank you for that.
Yeah.
Back to Allie, I have another question. So historically, it has been HOPWA, HIS, and SS. And now it's all just HIS, but it's still the total award amount. So I'm curious, how are you seeing that shift, and how would that impact an agency that would choose to take this on? I guess what's the reason for it not being HIS and SS seen as two separate things, and now it's just housing information services?
Um, Partially because I think of supportive services as being something that I want to see expanded through other project sponsors in the Hopwa space, as opposed to being like it is within this space and this space kind of alone. Um, but I do think there is opportunity as needed to bring supportive services into this if we so desire. There's a little bit of language in all of the RFPs. It's basically like we reserve the right to shift funding sources or service categories at various points in time as needed. But really, I want to see what comes out of the proposals we receive for the Hopwa tenant-based rental assistance and facility-based housing assistance and what they're able to cover, and have that focus on that and this focus on this.
Jen, so do you have any extension of my question and how it applies to, because just the way that it's currently been, it's been very separate, where HIS was basically subcontractor and partner agencies, and supportive services was kind of more done in-house, seen as supporting HIS. So I guess like, how does this impact a budget then? If it's all housing information services, can that include everything?
Yeah, and
Does
the
that make
only
sense?
comment I have to make, Allie, I know you
Yeah.
had called me and Sayul, but only comment is I remember HIS, I think SS wasn't always included in it. At some point, maybe in the last decade or so, it kind of got incorporated in, if I'm remembering correctly. So that's just how, like Allie said, it's been, and we've split it that way. So I guess just not a question, but a comment to add.
I would say, supportive services being a separate category, not involved in this, so it would not be involved in the proposal at this point.
So does that mean that there'll be a separate RFP for that then, or what are you envisioning?
I am envisioning seeing how things shake out with the tenant-based rental assistance and facility-based housing assistance proposals that we received for Hopwa and what they propose they would do in those spaces.
Okay.
And this is not the only one of those. Like, there's also like I'm holding on to the SPINS permanent supportive housing RFPs in a similar way. Like, let's see what happens from TBRA and facility-based housing, and then we'll base the PSH RFP on what we see from those.
And when you say supportive services as a separate category, you're talking about the essential supportive services through Ryan White with.
No, I'm actually making
No.
reference to Hopwa specifically.
Oh,
So yeah, so it's separate RFP that may come down the line. So tenant-based rental assistance, facility-based housing assistance, permanent supportive housing, which has historically been just sort of issued to the one tenant-based rental assistance program that we have. Well, we have now 12 applicants for tenant-based rental assistance, so let's see what happens with that in issuing those awards, and then let's see what happens with the permanent supportive housing coming after that. That's separate from the hub, but it was more just like as an example, there's things that we want to see what happens with the Hopwa RFPs, and then we'll make decisions based on that.
so you're saying there will be a separate Hopwa supportive services RFP down the road?
I'm saying there may be.
There may be. Okay. Got it.
Okay. So something I'd like to add with that just stated, and I didn't introduce myself. This is Saul Lavina. I'm a housing navigation manager. I'm on the SS grant now with AFC. So right now, the way HIS and SS is set up is that SS, provides oversight and support, to the HS component, and that's the structure of it right now. Since what I'm hearing, and if I'm inferring correctly, it's going to be separated. If a RFP is presented, how does oversight, does that just have to get restructured and kind of recreated in this RFP? And from a budgeting perspective as well?
Yeah, so an organization submitting their proposal to do the Syndemic Infectious Disease Resource Coordination Hub would have to propose their organizational structure based on the availability of services and funds.
Okay, great, thank you.
So I emailed you this question, Patrick, in regards to, I think it was the Ryan White medical case management question or the RFP. but similar question, I can ask it here, and I know there's other folks here who would probably like to hear the answer. So page 15 of the RFP mentions that there's a $50,000 minimum salary requirement. So my question would be, is that like hard line, everyone needs 50,000 minimum, or is there any wiggle room based on experience?
We want this to be the minimum.
Okay.
Yep.
Okay. And then I guess follow up to that. If that is the minimum, do you see any possible change in, say, like the number of like non-medical case managers or FTEs based on, the increase in salary as a minimum?
It is possible, right? That
Okay.
if there is X amount of money available and you're increasing the base salary for staff involved in that, then that cuts into it. The idea, however, is that we want folks to not have to have 2 or even 3 jobs when doing this kind of work. So if you can get by on one salary, as opposed to, like, I used to work for an organization where we had folks who were like case managers who had like, this is my day job. I got 2 other night jobs because that's what it takes for me to pay rent. And we'd want people to not have to be in that situation.
Totally. I think everyone's in support of this. We're just trying to figure out how to do it
Yeah.
and
And it's like
how
the
to make
compression side of
subcontractors
things as
do
well.
it.
Yep, absolutely.
Okay.
I'm at a PCORI conference, so I need to slip out for a plenary session. But thank you so much again, Patrick, for letting me know about this bidders conference. And I plan to reach out to Freddie at AFC to kind of follow up on my questions. Thank you so much.
Thank you, Mr. Fraser. All
Mel,
right,
did
y'all,
you
we
get
got
your
17
question
minutes.
answered?
Oh,
Yeah.
was there a question that I missed?
I didn't know if Mel, you had typed it in the chat. Did she get it answered?
Oh, yeah, no,
Right.
I see your question. So having seamless access to client level data, would that eliminate or lessen the need for reporting on what is easily accessed? Yes.
Oh,
Yeah.
awesome.
Yeah,
Okay.
like if I can just get in and take a look at stuff, I don't know
Hmm.
why I would need you to submit quarterly reports.
Oh, okay. I just wanted to ask because I know that I was there in the preliminary, conversations, and I
It
know that this is definitely something that's going to be brought back up. So thank you so much.
Yeah, absolutely. I mean, it dramatically reduces the burden on anybody. I think it would change to like ongoing monitoring would be like, all right, any challenges, any obstacles, anything cool
Mhm.
happening? Cool, let's move on.
Amazing, amazing.
Right?
Thank you so much.
Yeah.
I'm curious about the delegate agency request for advanced mobilization payment form, which is probably the sexiest form title. Um, so I noticed that it's in most of
Just
these
as
RFPs.
as an aside, my workplace Halloween costume is to come as the advanced mobilization payment form, just to scare the crap out of people.
I saw that and I was like, what is this?
Yep.
So I'm still trying to understand it.
Yep.
I went down the Google rabbit hole trying to figure it out. And it very clearly says this form is attached for information only and applicants should not complete the form at this time. But it also does say that respondents will need to indicate in their application whether they wish to exercise this option. So I'm wondering if you can just elaborate a little bit on what is this? What is the purpose? I don't want to say like pros and cons, but I guess so that we know, like, is it like a check mark, yes or no? Can that option ever be changed? How does this work? Because I'm sure finance is going to ask me a lot of questions and I'm going to say, I don't know, this is new.
I would say take an opportunity in specifically anything related to fiscal capacity
Uh,
to state that our organization plans on requesting advance payment. Like just to put it in there and make sure it's in there. The actual process itself, so it's important to know this is only for those services that are funded using Ryan White Part A, right?
oh, okay.
Nothing else, just Ryan White Part A. And the reason behind that is it's actually legislatively required by the Ryan White Care Act that advance payment be made available. It is not required for HOPWA. It is not required for CDC. Sure as hell isn't required by IDPH or the city of Chicago. But
Okay.
the Ryan White Part A requires that it be made available to ensure that organizations are able to uh, basically like provide services in advance of contract execution, right? If your contract execution takes a while, this is a way of getting the funds in advance so that you're able to start your services and bill appropriately. Um, so it's just for Ryan White Part A. It is something that just to prepare folks for it, it is not something that our system wants to do. Right. So we're not like set up for this to be a thing that every agency does. We acknowledge that by law, we have to make it available to every agency that receives Ryan White Part A, but our system's like, wait, what? What do you want us to do?
Yeah.
And like, it's not want, it's you're legislatively required to do this. So the way it typically works is and they're working on making some adjustments in anticipation of possibly an increase of volume of this because it has existed for a while.
Mhm.
But basically, the way it works is an organization submits, like if I were to do it now, I would submit a mock-up invoice for saying like these are the expenses I anticipate incurring for the month of November of 2025. And if it's all allowable, like broken down appropriately, it's all like it is in keeping with the budget, all that, then the city has the ability to issue funding for based on that mock-up invoice. And there's like other paperwork that needs to be required and all that. Then, as invoices are submitted by that agency, those invoices are reviewed and evaluated and processed. And if they are approved, rather than getting a payment at that point, basically you reduce the amount of money that is listed as having been advanced. So it gets liquidated against the advance. So if we give you $100,000 in advance, you submit an invoice for 75 grand. Cool. What about that other 25,000? Right. And
Yeah.
what has happened in the past is like if you then submit an invoice for like 30,000, like, okay, now you've liquidated the 25, here's $5,000 because that's all that's left out of what you submitted.
Yeah. It's like a weird escrow.
Yeah, it is. There's also are there going to be restrictions to the amount? I can say that yes, there will be restrictions. So if you get like what is it, $2.175 million in an award, you can't do an advance payment for $2.175 million. Like that ain't going to happen. But like what is an appropriate amount that could be used at different points in time, most likely at the beginning of a contract period to cover setup costs and getting everything moving while the contract gets executed. But a lot of that stuff is still works in progress between CDPH, Office of Budget Management, and the Comptroller's Office.
Right. And for this, it would only be the 1.2 million that it would apply to because it's just part A, correct?
Yeah, but and even with that, it would like we're not going to give you $1.2 million
Of
in
course.
advance. Yeah,
Yeah. I think it's at 25%.
something like that.
Okay. Thanks. I know that was a
Yep.
super fun question, but I
I love
appreciate
that
your
question.
explanation.
I love that question. And just as follow up from the beginning of this conversation, my in-laws are picking up my daughter right now.
That's good.
I'm gonna get the other one after work and take her to gymnastics class. Because apparently she's fine.
Nice.
Yeah, I feel like the cold that I had last week came with a backup friend. So I know things are just probably flying left and right all over the place for the kids. But the only other question I have, I understand like with the former name of the resource hub, so HIV resource hub, and the rebranding, is there an expectation for the rebranding? Obviously there's marketing materials, websites, things of that nature that need to be updated. Would there be an expectation that all of that shifts at the start, basically March 1st?
I would say I'll leave that up for discussion with whomever gets contracts.
Gotcha.
But my inclination is, yeah, not necessarily from March 1st, but that there be moves to change it to syndemic infectious disease. But also, like,
Gotcha.
let's talk about what that actually means. And it's the balance, right? Like, are
Mhm.
folks going to want to have HIV hub show up on their phones for everybody to see? Maybe
Correct.
not. But are folks going to know what syndemic infectious disease means? Maybe not. So, like, it
Mhm.
has to be something in the middle there, right? That, like, folks know what it is, but it doesn't give anything away.
Correct.
Microsoft Word does not think syndemic is a word.
I know.
I'm gonna have a hell of a time with this application, Patrick, because it keeps telling me that it's an error.
I know.
Like, it's a real word. I swear it.
I had the Office of Budget Management ask me, "Are you sure you're spelling that correctly?" I'm like, "No, hang on a second. No, I'm not."
So
I
I'm
was right.
curious about so I see very clearly the contract period starts March 1 because it's obviously a huge chunk of money that's coming from Ryan White Part A. It's now on a Ryan White calendar, which is different from how it has been. Both HOPWA, CDC, and corporate were January through December, which means the current contract ends for at least some of the funding, the end of December. So
No, no, it doesn't.
no, it
Actually,
doesn't.
no, it doesn't. We've
Okay.
done non-competitive continuation requests
Okay.
to our Office of Budget Management for the current contract, Hopwa and Ryan White and corporate to go to end at the end of February. So all current services should run through the end of February 2026.
Awesome.
It does, however, mean that there's like messed up like budget periods involved, right?
Yeah.
So CDC now runs June through May. HRSA runs March through February. HOPWA and corporate run January through December. And so in the event that we get things like partial awards on any of or all of those, then we're like, all right, how does all of this work? We'll do it. We will do it together. Because we're gonna have to figure out how to make all of our stuff align with all of those as well.
Right. Okay. That makes
Sounds
sense.
like
Thank
that
you.
would be a chart for the wall to keep
In
track
a
of all those dates.
in a room that I don't want to go into. Yeah, I think we've actually gotten pretty good at it at this point. But yeah, it was through a lot of really wonderful collaboration, honestly, I'll say with our contracts administration bureau, of like, hey, Patrick, I don't think we have a non-compete for the hub's housing information services through the end of February. Oh, okay, let me go write it real quick. Here it is. Cool. Hey, wait a minute. CDC's changed. We need to do that. Okay, cool. So it was really beautiful collaboration between our two bureaus to make sure everything was covered.
Sorry, I have all the questions, but I work with all of them. So I swear I'm not hugging all the time intentionally.
All
Um,
good.
What is the difference between non-medical case management under the Hub RFP versus non-medical case management under Essential Supportive Services RFP? And is there a difference?
No, the service category is the service category.
Okay.
Yeah, so yeah, there's no difference.
Okay. That helps. That helps a lot.
Good.
Okay. Thanks.
Sorry, I just realized I have another bidders conference starting in 4 minutes, so I'm getting that slide deck prepped. But y'all keep talking.
I think I'm good with questions.
Yep,
Yeah.
same here.
Yeah. And we have a site visit of one of our partners, so starting in 4 minutes as well.
Okay.
Yeah, fun times. Allie, I think. Any more
No,
questions?
I'm just typing in my questions I've already asked. I'm trying to help with Patrick's notes.
I so very appreciate it, Allie, and all of you. Thank you very much.
I'm typing in my last one as well that I previously.
Oh, I know I asked you this before.
Mhm.
Is there a way that you figure it out within eProcurement to get a printout of all the questions?
I have not. I did ask multiple times,
Okay.
and folks, I got a mix of there is a way, hang on, let me find it, to I can do it. All right, that doesn't help.
If they could do it, could they post it publicly?
Or just like bring it over to the AFC offices. Sure.
Right. Well, because like the RFP is available publicly on your website. So
Mhm.
according to Zoe Vaca, she said that previously that RFP link didn't just have the RFP, it actually had the RFP and all the questions attached.
Let me follow up and see if they got anything farther.
In theory, they could just, switch it out and just saying. But I appreciate
That'd be
you
rad.
asking.
Yep, of course.
I appreciate everything you have done, Patrick. Truly.
Yes.
Thank you.
Really, really.
I championed that. All right.
Thank you. All right. Well, shall we then?
Yes.
Yes,
Thank
thank
you,
so much.
everybody. Thank you, Patrick.
Thanks,
Thank
y'all. Have a
you.
lovely
All
rest of
right.
your day.
Take care.
Bye.
Hope your daughter feels better.
Yeah.
Thanks.
Bye.
Bye.
Yes.